posterior layer and anterior border. What I do, I also start from the mesentery only.
Yes, ma'am.
This is the area where the leak, maximum leak is at the mesenteric level. So what I follow is this one. One of you hold like this.
Yes, ma'am.
See, what I do is outside in. I'm coming inside. After that, I will do inside out. It is like a U. Ready? ಹೌದು ನೋಡೋದು ಹಾಕ್ಬಿಡು ತೆಗಿ ಬರೋದು
ಸ್ವಲ್ಪ ಹಿಂದೆ
ಸ್ವಲ್ಪ ಹಿಂದೆ ಹಾಕೋದು.
ಇಲ್ಲಿ outside in, inside out I came. Now same thing. It out. I did it once.
Yes, ma'am.
Step. That's it. This is what I always tell you people on table. See, what all you follow, no? You'll hold. You will do like this. You will pull. See.
Yes, ma'am.
That shouldn't happen. This is on the surface, okay. When you are in depth, if you pull like that, whatever you are suturing, yeah, the structure will come. Especially if it is an artery, definitely it will cut through. See, this is what. After this, see, I'm not changing my needle holder. I am keeping there so that if you feel it is too far, leave there and take like this. This is approximation. I did an approximation. Again same. 2 ends. Did it. ಅದಕ್ಕೆ mosquito hook. After this, we ask the assistant to follow. Now what I do is I go for the posterior layer. Less of no, my knot will not come. Second layer it will go. You say no. Less of mucosa, more of serosa. Here mucosa it is very small. So I am taking this. This one I do locking because it is at the corner, nothing else. Right. When you follow, no, you should hold here. That shouldn't come in my neck. After this, there is no interrupted suture. I go for continuous. They say between the two stitch it is 5 mm.
Distance from cuttage ಕೂಡ 5 mm.
You can take it. Always you should trim the edges when you do resection anastomosis for gangrene or malignancy, whatever it is. See that, and your edges should bleed. We put a clamp, intestinal clamp. Am I right? Why we keep is, one is to avoid contamination, second one is to avoid hemorrhage. So once you come at the anti-mesenteric border, we loosen the clamp and see it, whether it is bleeding or not. Sometimes there are small arteries, they bleed at the edge. That is from the mucosal layer. what I can do is, I think that day we put some 1 or 2 mosquitoes, small mosquitoes. Just apply and leave it till you go there for suturing. By that time they will stop. No need to cauterize them. You should not cauterize them. No, this one. Now after this, when I come to the anterior suturing, you see it is built. See, I covered the posterior layer. Yes?
Yes.
Now we are coming to the anterior. So here what is little extra time it takes. If I take like this, I'll show you. If I take like this, it comes like. What I do is, ಇದು ಹೊರಗಡೆ ಐತಾ?
Yes, ma'am.
No, this is inside. This thing is inside. You said outside. ಅಂತ ಬರುತ್ತೆ, ಅದಕ್ಕೆ ಹಿಡ್ಕೊ ಅಂತ ಹೇಳಿದ್ದು. This will take little extra time. ಬಿಡು. See, I brought the needle outside. Now all will be inverting.
Continuous.
No locking at all. ಬಿಡು ಅದು ಎಳೆವನಂತೀರ. Outside in, inside out. That is what I am doing. So your sutures will go in. What sir did is for the posterior layer, I will do for the anterior layer. When to worry for leak is if you are near the duodenum. Nothing else. Then large bowel. If it is small bowel, stomach, very rare to be leak. If there is a leak, then it is a surgeon's fault, not the patient fault. ಇಲ್ಲ ಅಷ್ಟೇ. ಹೇಳಿ. Hold here. Don't pull too much. See, always we see give respect to the tissue. It should be like this. You should not pull and take to your side. And it should be at the line of your incision. You are assisting to the surgeon, so don't adjust to your eye level. It should be adjusted to the surgeon size. I don't know, you people are observing me or not? Yeah. Because at the mesentery, I want my stitch to be outside. That's why. One more thing to be followed at the mesentery, I'll tell. ಹಿಡ್ಕೊ. When you put a knot, here the second, once you complete, it should be beyond the knot what I have put first time. That is how you can, what I took, that W shape suture, it never leaks, but still if you want to be have a sound sleep, then you do beyond that. Now this should come bit here. I am putting knot on the previous. ಕಟ್ ಮಾಡಿ. ಈಗ ಏನು ಮಾಡಿ ಗೊತ್ತಿ, ಹಿಡ್ಕೊ, ಎತ್ತಿ ಹಿಡ್ಕೊ, ಅದನ್ನು ಕಟ್ ಮಾಡಿ. Whenever you are asking assistant to cut, you should hold the suture like this so that it is grip for them. Now you put mosquito for this. Cut ಮಾಡಿ. The second one is not continuous, it is interrupted. The second layer will be very easy. You are taking, you are going away from the your first stitch. If you take only zeros also, never mind. Cut ಮಾಡಿ. If you take more of the edges while stitching first layer, then your next layer should go away from the your stitched area. See, I am covering the previous stitch suture line.
ಇದಕ್ಕೂ 0.5 mm ಇರಬೇಕಾ 1 centimeter?
ಇಲ್ಲ, it is, that is what I am saying. If you take this one first layer so too much, then you need to go away from that. There is no hard and fast rule. It depends upon the intestinal lumen what you are and which one you are suturing. If it is a large bowel, take 5 mm, because that is notorious. Large bowel is a notorious for the leak. That's why. What they say is this knot should not be on your line of anastomosis, but because of good vascularity, nothing will happen. When I did this one second layer, do you think it is done?
No, positive.
See, now you ask your assistant to hold or lift like this. Again, if you want, ಆಚೆಗೆ ಹಿಡ್ಕೊರೋ, ಅಲ್ಲಿಗೆ ಹಿಡ್ಕೊ. I am putting at the exactly at the anti-mesenteric, and then if you want, you can ask the assistant to hold with the mosquito, lift it so that it will be easy for you to put a stitch. Cut. ಅದು ಮಸ್ಕಿಟೋ ಇಂದ ಹಿಡ್ಕೊ, ಮಸ್ಕಿಟೋ ಅದನ್ನು ಹಿಡ್ಕೊ, ಮೇಲಿಂದ ಹಿಡ್ಕೊ, ಇನ್ನೊಂದು ಸ್ವಲ್ಪ ಮೇಲೆ ಹಿಡಿಯೋ, ಮೇಲೆ ಹಿಡಿಯ, ಕಟ್ ಮಾಡಿ, ಮೇಲೆ ಕಟ್ ಮಾಡು,
ಮೇಲೆ ಕಟ್ ಮಾಡಿ, ಅಲ್ಲ
ಇದನ್ನು ಕಟ್ ಮಾಡಿ. ಏನದು ಯಾರ್ದು ಅದು? ನಿಂದ? ಯಾರು ಸಣ್ಣ ಮಕ್ಕಳಿದ್ರೆ ಓಡೋ ಎದ್ರಕೊಂಡು ಅಲ್ಲೇ ನಂಬರ್ 1 ಮಾಡ್ಬೇಕು ನೋಡಿ ಅವರೆಲ್ಲ. ಹಿಡ್ಕೊ. ವಾರ್ಡಲ್ಲಿ ಏನಾರು ಕೇಳಿಬಿಟ್ರೆ ಹುಡುಗರು ಅದೇನಂತ ಒಳ್ಳೆ ಲೇಸಿ ಹಾಕ್ಕೊಂಡಿದ್ದೆ. ಸಾಕಾಯ್ತು ಗದಗ ಬಿಟ್ಟು ಹೋದ್ರೆ ಅಂತ ಹಂಗೆ ಹಾಕ್ಕೊಂಡ್ಯಾ? ಏನದು ಬಿಡ್ತಾರೆ ಯಾರು? 5 ಜನಕ್ಕೂ ಬಿಡಲ್ಲ. ಹಿಡ್ಕೊ. ಇಲ್ಲೇ ಇರೋದು 6 months ಆದಮೇಲೆ ತಾನೇ ನೀವು ಎಕ್ಸಾಮ್ ಕೊಡೋದು? ಹೇಳಾಗಿತ್ತಲ್ಲ, ಈ ಸೆಪ್ಟೆಂಬರ್ಗೆ ಎಕ್ಸಾಮೇ ಇಲ್ಲ. ನೆಕ್ಸ್ಟ್ ಯಾವುದು ಕಾಲೇಜಲ್ಲಿ ಹೋಗಿ ಕೊಟ್ಬಿಟ್ರಿ ಸುಮ್ಮನೆ ನಿಮ್ಮ ಬರತ್ತಾ? ಯಾಕಂದ್ರೆ ರಿಪೀಟರ್ ಬ್ಯಾಚ್ ಅಂತ ಇರಲ್ಲಲ್ಲ ಇಲ್ಲೇ ನಮ್ಮಲ್ಲಿ. ಅದಕ್ಕೆ ಕಿಮ್ಸ್ ಹುಬ್ಳಿಗೆ ಅಲ್ಲೇ ಹೋಗಿ ಎಕ್ಸಾಮ್ ಕೊಟ್ಬಿಟ್ರಾಯ್ತು. ಅದು ಬೆಸ್ಟ್. ಅದು ರಿಲೀವ್ ಇಲ್ಲ, ಏನಿಲ್ಲ. ಜೂನಿಯರ್ಸ್ ಮತ್ತು ಪೆರಿಫೆರಿಗೆ ಹೋಗ್ತಾರೆ. ನೀವು ರ್ಯಾಂಕ್ ಬರ್ತಿರೋ ಇನ್ನು 6 ಮಂತ್ ಬಿಟ್ಟು ಏನಾದ್ರು ಎಕ್ಸಾಮ್ ಕೊಟ್ರಿ 5 ರ್ಯಾಂಕು ನಮ್ಮ ಕಾಲೇಜಿಗೆ ನೋಡಿ. ದೊಡ್ಡದೊಂದು ಬೋರ್ಡ್ ಹಾಕ್ಕೊಂಡು ಹಣೆಗೊಂದು ಪಟ್ಟೆ ಕಟ್ಕೊಂಡು ರ್ಯಾಂಕ್ ಅಂತೇಳಿ ಬಿಡ್ಕೊಂಡು ನಮ್ಮದು ಹೆಸರು ನಮ್ಮದು ಕಾಲರ್ ಮೇಲೆ ಇರಿಸ್ಕೊಂಡು ಓಡಾಡ್ಬೋದು. ಸೊ ದಿಸ್ ಯು ಆರ್ ಸಪೋಸ್ ಟು ಸಿ ದ ಪ್ರೀವಿಯಸ್. ಕ್ಯಾನ್ ಯು ಸಿ ದ ಪ್ರೀವಿಯಸ್? No, nothing. And interrupted, no need to be very close. Because first layer is the one which is going to heal. So this is for just to cover the previous suture line and double protection. Third one is, if this area is raw, there may be an adhesion by the omentum. Yes. Patient may have obstruction. So all this considering, we are going for the second layer. That's all. It's very soft one. Goat intestine. That's why it's very soft. ನಮ್ಮದು ಲಾಸ್ಟ್ ಟೈಮ್ ತರಿಸಿರೋದು ಫುಲ್ಲು ಮ್ಯೂಕೋಸಲ್ ಫೋಲ್ಡ್ಸು ಎಲ್ಲ ಇತ್ತು. ಇದು ಗೋಟ್ ಸರಿ ಇಲ್ಲ. ಇದು ಮೋಸ್ಟ್ಲಿ ರಾಯಚೂರಲ್ಲ ರಾಯಚೂರು ಗೋಟ್ ಇರಬೇಕಿದು. ಸಿ ಹಿಯರ್ ಒನ್ ಮೋರ್ ಐ ನೀಡ್ ಟು ಪುಟ್. No, just to show you, I left here. Otherwise, you complete the anterior one and then go to the posterior one. Cut ಮಾಡಿ. At the end of any anastomosis, always you should feel that your finger should approximate it, so that there is no through and through anastomosis. And second thing is, release the clamp, see it if there is any ooze anywhere because you put an interrupted, then take one more bite. Don't cauterize, never ever. Cautery should not be used. After this, I was telling about the mesentery. Okay, in between, see, can you see there are two?
Yes, ma'am. Anterior and posterior.
In between is the blood vessels. So always take again an interrupted only. Cut ಮಾಡಿ.
ಮ್ಯಾಮ್ ಹಂಗೇನಾದ್ರು ಥ್ರೂ ಆಗಿದ್ರೆ ಮತ್ತೆ ರಿಸೆಕ್ಷನ್ ಅನಾಸ್ಟಮೋಸಿಸ್
ಇಲ್ಲ
ಜಸ್ಟ್ ರಿಮೂವ್ ದಿ ಸೂಚರ್ಸ್ and
remove the sutures and then you need to better you avoid making it through and through. That is the idea behind doing surgery, no?
Yes.
Who will do through and through, you know? That's why I did not say in front of sir. Sir wife is a gynecologist. Gynec people. Many times gynec people will do through and through. I'll show you the posterior layer of the mesentery. Okay? See, can you see here?
Yes, ma'am.
I put there. This is anterior I have put. Now you put the posterior. Why I'm stressing, you know, other day Karthik had called. Yes. He did resection anastomosis and he closed mesentery in one go. After that he called me, madam, I have done like this, whether it will go for issues. Somehow it was an jejunal resection, anastomosis, so jejunum will have a good blood supply. It has not gone, but otherwise you are, that's what
one side open ಬಿಟ್ಟು internal hernia ಆಗಿ
ಬಿಡ್ತೀಯ ಯಾಕೆ ಬಿಡ್ಬೇಕು ಯಾಕೆ? raw surface, you are covering the blood vessels, adhesions, or it is a ಇಂಥ ಪೆರಿಟೋನೈಟಿಸ್ ಅಲ್ಲ, ಇನ್ಫ್ಲಮೇಷನ್ ಆಗುತ್ತೆ. ದ್ಯಾಟ್ ವಿಲ್ ಲೀಡ್ ಟು ಅಗೇನ್ ಅಡೇಷನ್ಸ್. hardly take another 5-10 minutes and never ever operate with your clock. I did 10 minutes appendix. No, that is not greatness. That is not the greatness. That's why, see, they have done a study in US that female surgeons are very meticulous and surgery done by females less complications. And because they are very particular in everything, post-op and even intra-op also, they may take little extra time, but the result will be good. So don't compare and let the people talk anything about you, but you know how your limitations, so you follow that. This is little closer, it should not be that closer also. Some 3 to 4 stitches enough for mesenteric closure. The first one sir was telling, no, it should not be too tight because you're just approximate. See, peritoneum, when you open the peritoneum, now this, not now, when we were PG, we never used to close the peritoneum. It heals by epithelialization. So no need. Similarly, here also, when lumen is like this, you're just approximating. You are not going to put it so tight. No, not like, just heal itself. The second layer, you make a little tight. No problem. ಆಯ್ತಾ ಗೊತ್ತಾಯ್ತಾ ವೆರಿ ಈಸಿ ನೋಡಪ್ಪ ಪೋಸ್ಟ್ ಆ್ಯಂಟೀರಿಯರ್ ಮಿಸೆಂಟ್ರಿಕ್ ಕ್ಲೋಸ್ಡ್ ಸಾಕ
ಥ್ಯಾಂಕ್ ಯು
ಥ್ಯಾಂಕ್ ಯು ಮ್ಯಾಮ್